At the core of what we're trying to do here is something that really is the leading edge of a trend in healthcare, and that is putting the patient at the center of everything that we do. 70% of the preventable illnesses that people in this country experience today are related to health behaviors that can be changed. Primary care really is the foundation because it gives you a place where patients can come back and forge a relationship with a team that engages them in their care.
As everyone knows, there's 30 minutes for a patient visit, and there's a lot to do in that 30 minutes. So what we've done is create tools that can easily obtain the information
and allow more time for the provider to have a different conversation with the patient.
If you begin to ask them questions about what's important to them in their life, people are going to look up and think, that's important to me. You have to engage a patient to have them engage in activities that are going to change their health. Finding an approach that connects with them and works uniquely with who they are as human beings is one of the most gratifying things both for the veterans and for their clinicians.
From my perspective, the visit is more valuable. I feel like I can accomplish more and I can do so face to face. And I think the patients really appreciate the fact that in that one day or morning, they accomplished a lot and actually got the results.
And we're noticing our biggest advocates are our patients. They enjoy it, and they are asking some of our primary care social workers if we would offer this at different locations.
In order to organize a medical center to support whole health, it really does need to come at all levels.
You really are going to have to figure out how to introduce some training.
One of the very first things that is needed is preparation, pre-planning.
To think through who's really going to be doing this personal health planning. How is that going to get shared with the team?
The health tech takes the vital signs and does reminders, but what he's doing is actually finding what is important to the patient and finding out what the patient's goals are. So I have all that information for me by the time they come to me.
And that's incorporated on a form we call the Whole Health Review of Systems form.
So the benefit of having a tool is it helps you, because the traditional approach may not lead you to that, but by looking at some of these components of health, it actually draws you into areas that you might not have pursued.
I could tell everybody was centered on, supporting me. I felt like it was a happy accident, but apparently it's part of the way they organized it.
One of the key pieces is the leadership. And that leadership really has to not only buy in and get behind the patient-centered care initiatives, but actually model it for the providers.
If you wait a generation or two or three to make changes, change is going to be far too slow. So in a sense, the people who really need to be the change agents are the older practitioners. The challenge is, how do you do this without adding to the burden of already very busy practitioners?
Once you get good at this, you're actually utilizing less time because you really know that person.
It allows you to have conversations that, even though they're not what we're used to talking about traditionally in medicine, it actually was the root cause of his difficulty managing his chronic condition.
We need to know what's going on in their lives outside of these walls, because that's where they live. That's where the behaviors are going to change.
Anytime you're doing this kind of work, it has to be clear that it can't be more work on a team or on a provider. It really has to be embedded into the current work, and there should be advantages clearly to the patient first and also the team.
Flipping the whole model to one that's based on helping veterans identify the things that they can control that are important for the health goals that they've set becomes the foundation of care in our system, rather than simply subdividing them into a series of medical problems that we hope to address. This is the kind of medicine that we all hope to practice when we went to medical school, taking care of patients as holistic human beings.
I try to tell clinicians that it's a partnership. It's not physician leading patient or patient solely leading physician. It's truly walking side by side.
We now have that person to go to in the VA system, who is that one-on-one person that'll direct you to wherever you need to go, be it the mental, the physical, the spiritual.
you realize the patient walks away thinking, wow, I have been heard.
And making the shift from what providers want from a clinical standpoint to what patients want for their lives has been the most, I think, exciting part of our work.
It's really amazing to see that the VA is actually partnering with patients, and the power behind that is really, it's limitless when you think about it.